thoughts on wellness and prevention in the age of AI. And may I request Mr. Jadeja.
The sort of report card of a nation, or a health report card of a nation. And you have a two perspective there. One, that you probably go and look at what are the indicators that are impacting, correct, negatively, and what are some of the factors where we have made significant impact. And I'd like to focus on both sides of it and kind of see a parallel and draw a line where we could kind of zero down on wellness and prevention there. At Remedio, we are probably one of the very unique and a different medical device company. Early on, we realized the power of a smartphone, and we kind of took a bet that if healthcare needs to create an impact, a real impact, it needs to start with something that is personal. And there's nothing better than a smartphone, correct, when you look at India right here. Now, how do we use this wonderful device and create a clinical grade medical device so that it can be used and bring its impact to a last possible mile? How do we create a care which is equitable? How do we create a care that is accessible and affordable? So that has been the journey so far. We have screened more than 16 million people on chronic eye conditions like diabetic retinopathy, glaucoma, age-related macular degeneration, and so forth. And we have been very proud in our humble achievements and success in that journey. However, we keep asking this question, what more we could do, right? That's not the end of a journey for us. And we learned that beyond just vision. Things like cardiovascular risk factors, chronic kidney conditions, liver, and with our simple, easy to use smartphone technology and privacy preserving AI which runs on the device itself, correct? How do we use this technology and use it into a wellness and prevention of other eye conditions? So that has been journey so far we have been on, and we are very happy to kind of have one of the largest hospitals and experts and clinicians collaborate with us in this journey to kind of build this AI innovation out there. So yes, we are super excited about it, and we are looking forward to see how we can collaborate with many of our colleagues here on stage and also in the conference to basically roll it out in the masses in India. Okay. With that, I'll invite Venkat to talk more about how they are looking at prevention.
Thank you. Good afternoon, everybody. I'll just briefly talk about the work that we are doing. So we started with AI-based diagnosis. So that was the first thing that came, because most of the time we are detecting a condition using AI models and development. Either most of the eye diseases, we use the AI models to detect conditions. But somewhere down the journey, I had, but it's okay. I did have few slides, but it's okay, I'll just talk, it's okay. So we found that merely diagnosis is only the first step. So we just take a good first step and maybe address conditions like diabetic retinopathy, glaucoma, and all those common eye conditions. But these are not entering into the zone of prevention. So I think that the topic theme today is prevention, the age of AI. So I'll just briefly talk about what we are doing in the area of prevention. As we all know that, I think just now Shay was mentioning about the eye as a biomarker for body condition, particularly for cardiovascular, nephro, neuro, and even some of the autoimmune conditions. So we have started work on it 2 years back, and this took it to the next level with the clinical trials and assessment. And the conclusion that we could clearly derive based on the trials is that eye can become, or I would say retinal images in this case, excellent biomarker for conditions that manifest much later, particularly for cardiovascular and National Institute of Mental Health and Neuroscience. And now we are continuing a much wider trial to really confirm on the prevention angle whether it is scaling up to a large population. So what it indicates to us is that normally we are doing blood tests, all those kind of traditional diagnosis methods to check these conditions. I think it's time to also look at some alternative mechanisms like looking at a retinal image, for example a non-mydriatic retinal image where you don't need to do anything, just sit in front of a camera, it will capture an image and you can extract excellent parameters with which you can do a very good initial assessment which is correlating very well with the traditional things like Flemmingham scores. So this is the work that we have been doing the last few years and it's showing tremendous promise, and I think it's time to scale this and look at this as a serious option for an alternative. It is it contains wealth of information which can be explored. There was also a mention of a policy brief, a request for that. One request that I have is, this is something that even government and private institutions can do, is along with the traditional data that is being collected, if they also take a retinal image and keep, for example, similar to the UK Biobank. You see the UK Biobank, they have very good, excellent repository of images and conditions and very good metadata as well. So this can, particularly with our population, it can push and we can become a leader in this with the sheer population size itself and come up with alternative ways of diagnosis and prevention measures. So that is one suggestion from my side. That's it. Thank you. Dr. Abhishek.
Great. So I'll speak a bit about the work that we do at Butterfly. So Butterfly takes care of kids between 2 to 12 years of age, kids who have autism, ADHD, learning disability, conduct disorder and other behavioral issues. Now when we started, the fundamental problem in India and globally is, I'll talk about Indian numbers first. 1 in 10 kids under the age of 12 has some sort of neurodevelopmental disorder. That's a total of 30 million or 3 crore kids in India as of today. Whereas on the supply side, you have only 20,000 therapists who are catering to this demand. Now, when we started, we quickly understood that this is the gap that we want to address, and to address a gap of this proportion, it was very clear that we would have to create our own protocols and we would have to use technology to ensure that the protocols are delivered with fidelity at the point of care. Over the last 5 years, we've built 80 centers. We are among the largest providers of evidence-based therapy to neurodiverse children in India. But more important...
Am I still audible? Yes? Okay. So we think about wellness really inside the four walls of the hospital. How is care delivered? How is information is delivered to the patient? How accurately that information is delivered? And we also build a few products for remote care, which is keeping the patients healthy. So this is across our different products that we do as a company. Tattva Practice, which is India's first multimodal EMR. GoodFlip, essentially a chronic disease management platform, attacks metabolic syndrome as a key therapy area. Pillup, which is a pre-sorted medicine. Visit under the employee benefits and wellness, and Zyvalor, labs for AI, kind of builds AI across these continuum, across these different continuum. I wanted to quickly show a demo. Does the audio work here? Let's try that.
बताएं और मैं इन्हें डॉक्टर के साथ साझा करूंगी ताकि वे आपकी बेहतर और तेज देखभाल कर सकें।
मीरा, मुझे पिछले 2-3 दिनों से काफ़ी तेज़ बुखार आ रहा है। साथ ही
समझ।
में मेरे को जोड़ों में दर्द भी महसूस हो रहा है। भूख भी कम लग रही है और कहीं कहीं शरीर में लाल निशान दिख रहे हैं।
आपको पिछले 2-3 दिनों से तेज बुखार है, जोड़ों में दर्द है, भूख कम लग रही है और शरीर में।
So I'll just pause here. Essentially, what you're seeing is a voice-first AI agent, which is deployed inside the hospitals. As soon as you book the appointment, the patient gets a message, and then the patient can talk about the symptoms, inform the doctor about the different problems that he or she is facing. The real magic really comes is once all of this information is recited by the patient, the agent on the doctor side, what you saw here is everything was being talked about in Hindi. It gets converted automatically into English, and by one single click, all of these symptoms are captured inside the EMR against the patient record. Just wanted to share a quick learning. This has been live in one of the 600 bed hospitals across Gujarat. Just in last 1 month, about 1,000 symptoms have been collected. What is interesting to see is we talk about clinician burnout. There have been an increase of by 42%, where patients RX now has different symptoms that were recorded, which wasn't the case before here. But really, as we take this discussion forward, we're going to talk more about our GoodFit product as well, and how we are defining really a compass of metabolic score, which keeps the patients healthy at home, using our 5-pillared approach, which is really diet, exercises, nutraceuticals, and a digital therapeutics platform to support it. So you can disconnect the slide here and we'll take the conversation forward from the seat. Percent of population in India, there was a metric which was talked about in the previous session, about 80 million patients, people have diabetes, right? And that's just the tip of the iceberg. Below this is really, a bunch of metabolic diseases, fatty liver, obesity, cardiovascular issues, etc., resulting because of metabolic syndrome, right? And really what we've been busy doing is creating a AI compass, so as to speak, which presents a number to it. We call it metabolic score. We are in the phases of doing that all the lifestyle changes, all the medicines that I am taking, does it really improve? Is my health improving, or is it staying same? So that's really kind of how we are looking at the wellness part of it. But really across the symptom, when you connect it to the payer market, the insurance, this could certainly serve as